Absia do asese wonya bre na wotwen afa ye to ayen sebro eso ye ko atifi epoye mantum na ye kodo nsap openipa ohwe apomden ensam so Dr. Damien eye pungri ono en watchem say so ba empotem ho no mo asade Ghana ban aye enhye papa ho no mo efa apomden ensam hono nam so e ma sade na ema ekwo awo so oto ananom ewo ense do dwedwe no sesi asa haw ni nyina eto etwa.
The maternal mortality actually declined from 118 per 100,000 live births in 2016 to 65 per 100,000 live births in 2021. And then perinatal mortality actually went up from 8.6 per 1,000 live births to 10 per 1,000 live births. Certainly, no maternal death is acceptable, and that is why we still consider it to be high. And so, what is the region doing? Currently, what we're doing is building the capacity of the health workforce. There's a lot of training ongoing at the regional and district level to build a capacity of the health staff who have been engaged to work in the region in maternal and newborn care. We're also working with partners to work on some quality improvement initiatives where they identify gaps in the health service delivery. Questions are asked. We model interventions to address those critical needs. We're also sending, staff for further training in certain critical areas like specialized nurses in maternal and child health, doctors going to do pediatrics, and some of them are coming, obstetrician gynecologists, some have come, others are currently in school, just to be able to build up the human resource base of the region. The region too has also been zoned. If you look at the map, it's quite big, so it's been zoned into three. We have the eastern zone, that is where the Sisala areas, Sisala East, West, then that is the DBI. Then the western zone, comprising Nandom, Jirapa, Lambusie, and then the central zone, where we have divided the specialists who are in, the gynecologists and the pediatricians, to have quarterly meetings with the staff in those areas, where their capacity gaps are identified and then they are built and addressed. Any death that occurs, they go to the facility level to try to see what really went wrong. And then they identify the causes and then address them to prevent further loss of lives. Again, you will appreciate that when the minister made a presentation, he outlined a number of health initiatives. CHIPS compounds, health centers have sprung up. And you agree with me that once these facilities are becoming functional, they take care of people exactly where they live and work. So they don't have to travel long distances to access healthcare delivery. Improvement in the road networks. He talked about the Kulung and those areas. Previously, during rainy season, they couldn't cross. So what happened to a woman who was in labor across the waters? They basically were left onto their own, and the health staff who were just there. So when it's beyond their level, they cannot cross. But with these road networks improving, certainly indirectly it's leading to what? Improvement in healthcare delivery.